Hello, my name is Tebony Kingston and today I'm going to present to you about Indigenous health and diabetes. So I'm going to use diabetes as a specific example of some of the health issues that the Indigenous people in Australia suffer from and what the government has done to try and improve this, and finally what we as teachers can do to try and help their situation. So to start off with, I thought I'd define diabetes for you. And the definition here, as you can see, is diabetes is a disease that occurs when your blood glucose, also known as your blood sugar, is too high. A little bit more in depth, blood glucose is your main form of energy that you get from your food, and for that to be used as energy in your muscle cells or even your lipid cells to store your energy, you need insulin, which comes from your pancreas, for your body to actually absorb that from the bloodstream. And diabetes is where that doesn't work so well. And there's three types of diabetes. Type 1 diabetes, where the insulin just doesn't get produced in your body. This is an autoimmune disease, so there's no cure, and there's no known way to prevent it. They're not exactly sure of the cause. There's type 2 diabetes, which is usually an adult onset disease, so very rarely found in children. And then one that not many people know about is gestational diabetes, where it occurs in pregnancy, usually stops when the baby is born. However, it increases the woman's risk of getting type 2 diabetes later on in life. And type 2 diabetes is where the insulin just doesn't work as well. And the body doesn't make it as well because the cells have become resistant. So moving on, as well as this, the main issue with diabetes isn't diabetes itself, it's the more serious complications that come with it. And some of these include heart disease that it can lead to, or stroke, or kidney disease, or eye problems. Some people go blind, dental disease, nerve damage, especially in your extremities, or foot problems. Lots of people lose toes even. So you can see how this would be a major issue for people. It's not just having to test your blood and make sure you don't eat as much sugar. It's a major life-threatening problem. So type 2 diabetes can be prevented and managed, and some of the ways that you can do this is through regular exercise, a healthy diet, not smoking. Tobacco has been shown to increase your risk of type 2 diabetes. Lowering your blood pressure, so decreasing the amount of stress in your life, which can do that, and losing weight, so decreasing the amount of fat. Breastfeeding has also been shown to reduce the risk of type 2 diabetes in older women after they've given birth, and intermittent hypoxia programs have been shown to help people that are at risk of type 2 diabetes and decreasing the chance of them actually getting it. So some statistics that are quite shocking are that just over 1 in 10 Australians die from diseases that have diabetes as an underlying or associated cause of their death. And altogether that's 17,000 deaths in 2017 alone. It's actually the world's fastest growing chronic disease. And in remote and very remote areas, which is it relates to Indigenous people because they're one of the high populations in remote areas. These areas have had diabetes hospitalisation and death rates that were 2 times as high as those in major cities. And more specifically, Indigenous Australians are 4 times more likely to have type 2 diabetes prevalence, hospitalisation and death rates as non-Indigenous Australians. So that's a massive difference, 4 times as much. And as you'll see on this graph here, it actually shows the difference in age. So if you go from as early as 2 to 14, which as I've said is very rare because type 2 diabetes is known to be an adult disease, 0.5% of Indigenous people have type 2 diabetes at that age, whereas in non-Indigenous it's not applicable. Go all the way to 55 years and plus, it gets up to 40% in Indigenous people and only 14% in non-Indigenous. So the difference is huge. As well as this, diabetes has been going up. The statistics say that between 2001 and 2013, the rates of diabetes and high blood sugar content has been increased in remote areas from 5% to 7%, and in non-remote areas, and in remote areas from 8 to 11%. And it doesn't seem like much, only 2 or 3%, but that's actually quite a lot of people's lives that are being put in hospital or dying. And Torres Strait Islander children are actually 8 times more likely to have type 2 diabetes than non-Indigenous children, which again is a massive difference that really shouldn't be occurring in our country, and hopefully we can find out what we can do more about it. So if we look at the historical and cultural and social context of it, we can understand a little bit more about why we have such a big gap in these health problems. To start off with, before the British came and colonialised Australia, Indigenous people were known to be hunters and gatherers, which is a very active lifestyle and healthy without refined foods and a sedentary life. They were known to be healthy, fit and lean, and we don't know of any chronic diseases such as diabetes that they had. There's no record of them having these types of diseases before the Europeans came. Post-colonialism, however, with a lot of the policies such as the stolen generation, they caused a lot of assimilation for the Indigenous people into the Western lifestyle. And this caused them to introduce different foods into their diet, such as refined flours, sugars, tobacco, and different refined foods, which increased their risk of diabetes. As well as this, they lived more sedentary lives as food was given to them, or they bought food instead of going out and actively getting it. And as well as this, the stolen generation and policies and things that happened to them caused a much higher stress for their life, which increases their blood pressure, which again increases their risk of diabetes. And so going from no record of any diabetics before colonialism, diabetes, the first case of an Indigenous person with diabetes was in 1923, not long after colonialism and assimilation into the westernized lifestyle. So you can see that Europeans coming in and introducing Indigenous people to this different lifestyle and forcing them to assimilate can be held as being responsible for them actually developing these diseases so prevalently in their society now. What can help? Studies show that competent and culturally appropriate primary healthcare services can be effective in improving diabetes care and outcomes for ATSI people, ATSI being Aboriginal Torres Strait Islander people. And especially when they apply continuous quality improvement, they experience improvements in both service delivery rates and clinical outcome measurements in the ATSI people. As well as this, lowering these risk factors that we just talked about before to prevent diabetes in the first place, such as a healthier diet, exercise, reduce smoking of tobacco, reduce stress and blood pressure. If you reduce these things, you reduce the amount of people that get type 2 diabetes in the first place. So what has been done? Well, in 2013, which is very recent, considering this is such a big issue and has been for quite a while, but anyway, in 2013, Diabetes Australia developed an ATSI diabetes action plan. And this was the first of its kind to guide future approaches in Aboriginal and Torres Strait Islander diabetes policy and program development. And what they did is they gave this action plan to the federal government and proposed that they implement this nationwide. 2 years later, at the end of 2015, the federal government actually did something about it, and they introduced an initiative, the Australian National Diabetes Strategy, that was supposed to be implemented between 2016 and 2020. So this is still in process at the moment, and this includes 7 goals that they've aimed to achieve. And I'll just go briefly through each one of them, but I want to focus particularly on goal number 5. So it includes prevention to promote awareness and early detection Goal 3 is to reduce diabetes-related complications, such as the heart failure, kidney disease, blindness, foot problems, and improve the quality of life for those with diabetes. Goal 4, to reduce the impact of pre-existing and gestational diabetes in pregnancy. Goal 5, to reduce the impact among the Aboriginal Torres Strait Islander people. Goal 6, to reduce impact among other priority groups, such as the elderly and people from different cultures and languages. And Goal 7, to strengthen prevention and care through research, evidence, and data references. So as I said, I want to focus on goal number 5, which is to reduce impact among ATSI people. So they have actually a 10-step action plan, and I will try to go through each step very quickly because we're running out of time. But yeah, just briefly, the first step was to increase the efficacy of primary healthcare services by having them have access and benefits of diabetes support, education and services. And this is through services such as Aboriginal community-controlled health services, where and if they exist. And if they don't, then culturally competent mainstream services. And the importance is that they're culturally competent. You can't just go to any hospital that isn't aware or respects their culture. And as well as this, encouragement and facilitation of food security, healthier choices and lifestyle changes in these primary healthcare services. The second action plan was for pregnancy in earlier years, to provide programs for these people to improve the family and child health needs. The third one was to educate, community-wide education with culturally relevant awareness programs, including school education programs. So actually going into the schools and teaching the kids the seriousness of diabetes and the complications of it, and how you can actually live your life to prevent getting this, and how to manage it if you do. And again, they need to be culturally and language appropriate, so in the language of the people who they're giving the service to. Also to educate parents, programs for preconception, pregnancy and early years, to inform men and women, and to detect gestational and previously undiagnosed diabetes and manage it through pregnancy, and coordinate follow-up and postnatal care for mothers and babies. And to quickly go through it, I won't go through each point because we're running out of time, but basically to help by going through education for all people, all ages and stages of life, so that they know the seriousness of it and how they can live life to manage it to the best of their ability, avoid these serious health problems that can come about because of type 2 diabetes, and to prevent it in the first place, and bring up their children so that they don't have type 2 diabetes as well. Also, a major thing was that they wanted to increase the access for these people, especially in remote areas, and this includes access to fresh food and healthy food, and not just access, but increase the affordability and the consumption of fresh foods, and therefore decrease the consumption of sugar sweetened beverages and high fat, high sugar, high salt and highly processed foods. As well as this, they wanted to increase access to specialised healthcare. So for people that do have these complications, such as going blind, they need these specialists to actually give them the appropriate care to manage that. And so the government wanted to increase the access that they have to these services. And as well as this, they wanted to increase the primary healthcare services so that they can better identify and help people manage their type 2 diabetes. As well, they wanted to encourage the use of the My Health record, which is an online database that doctors can share between each other, so that if you go to one doctor, the next doctor that you go to will have the notes of the previous doctor of the treatment that he's given you, and all the other records. So to evaluate this initiative, it's a little bit difficult because it only ends in 2020, which is next year. So we don't have any results or statistics of how effective it actually was. However, the action plan itself, I believe, is a very holistic approach, because for starters, in every aspect, it has a respect for culture and language, providing translators, appropriate language on packaging and services for those people that they're servicing. It's also addressed the access to many different services that has previously been a massive problem in remote areas especially, such as fresh, healthy food and specialist care. And it addresses remoteness by implementing things like flying doctors and specialists, and as well as it actually includes social and environmental risk factors when they educate the young children. So if this is effective, which we will see next year, these effects may actually benefit the prevalence of other health problems such as obesity, heart disease, and a lot of other health problems that are related to it. So what does this mean for us teachers? If the government initiative works, that will be great and will reduce the problem and actually take some responsibility for what the Europeans have introduced to Indigenous populations. But for us as teachers in schools, there's actually studies that say that schools have teachers that are ignorant about students' health problems. So they just don't know about the management and the care and the specifics, especially of students with diabetes. And this affects their disease control and their quality of life. As well as this, the school rules often affect the way that the student can care for their diabetes during school. Ways that we can avoid this is, number one, get educated. Learn about the health problems, and this isn't just for diabetes, it's for any health problem that your student has. Learn about it, learn about the specifics of it, how you can help support them so that they can manage it effectively. Develop a plan for students with health problems. So just as you would for students with learning difficulties and how you'd create an ILP, you need to create a plan for these students as well. This can include nurse care visits at school and communication with parents, nurses and doctors to really develop the best plan for them to support them. To train staff and classmates, studies have shown that this isn't embarrassing for the students. It actually improves their quality of life at school as well as their disease control. To train the staff that teach them as well as their classmates to look out for them. As well as this, to allow flexibility, the maximum amount of flexibility for students to actually care for their diabetes. This could mean allowing breaks in class for them to test their blood. If their blood sugar's low, don't force them to do their work because they can't think straight. You need to actually address it and give them the proper care and management. And finally, the government's put in place these initiatives. Take the opportunity to be a part of it and actually implement these education programs in your schools. And sometimes this takes initiative, but that's what us teachers are all about. So hopefully we'll get results next year as far as how successful the government has been in improving this. But as far as us, even if it's not successful, we can still use these plans, these strategies in our classroom to help our students with health problems, especially diabetes, to really get the support that they need.